Today we have with us Dr. SADATH SAIT, BHMS, Director and Chief Consultant of SAIT Homeopathy Kochi, Kerala, India. More than 26 years of experience, former faculty of Institutional Homeopathy Kerala. The topic is complaints of hair and difficult skin complaints.
So thank you so much for inviting me again to the IFPH platform. Today I'm just going to be presenting 3-4 cases, which was one of the difficult cases or in my career, I can say. I don't know whether it will be a tough for others, but it was one of the toughest case I have ever faced because I didn't know. The patient was close to me since long time because they've been my patients. It's let the picture talk to you. That's what I was just thinking about it. Instead of me going and talking too much on that cases, let my let the cases present. I'm just going through with the slides. I will explain you what is a case in after some time. These are the cases. These are the pictures available for you. Okay, slowly you can watch all these cases, all this ones, one by one. The different stages of the skin complaint. Okay, this was the case. This was the situation when the first patient came. Okay, the patient name is Roma. She is almost 60-year-old. The issue with this patient was she had an osteoarthritis. And she came to me and she has been regularly, whole family was my patient. She used to come to me for different reasons. Even osteoarthritis, she came to me. And I gave some medicine of that day of bryonia and some osteoarthritis, calcarea floor, all that, osteoarthritis and pain for the pain medicines, Bulgaria, I gave it. She went back. In 2 months, she didn't turn up. I thought that case is gone because their family had a lot of other physicians also. I thought the case is gone. Actually, the same thing happened. The case is gone from my hand. Osteoarthritis, they went into the pain was not getting better. I've told them it will take little time because that swelling has to come down. Everything has to come down. It will take at least a month time. I've explained everything, but always when the patient is there, a lot of relatives become two good doctors and two good marketing people for different system of different system of treatment. So this lady was forced to go to an Ayurveda. Okay, Ayurveda. What they did was, I don't know what was happening. They did a wrap up to reduce the swelling. Some herbs they did the wrap up. They bandaged it, and she was taken home for 2-3 days. She was supposed to keep this, and after 2-3 days that was supposed to be removed. And second time when they went after wrapping up, this was the situation. So what to do was the next. They can't come to me. They were not. They were scared to come to me. At last they came to. This was a situation 2 or 3 years. This case came last 3 years back. So such a what I call severity of skin complaints, I have never done that. I was not confident of doing it. Complete bulle with this right picture is showing complete the skin ectodermis getting peeled. Total oozing of water, serum. It is completely messed up. Every picture will give you a difficult state of affairs. Okay, this was a condition when she came to me. This is the second picture. She came to me complete water oozing. The It was like they used to keep they see that towel which has been kept down. It was completely wet in 1 hour, and they keep changing. I was also under the impression whether to refer the case, take the case. They said, if you are going to treat me, we will treat it. Otherwise, we are not going to do anything with it. Let the allopathy surgeons, they told them to get admitted and get everything taken off the skin, then come back. It will take a process of almost 2 or 3 months. So they were not willing for that. I don't know what made them confident on me. They said, only you can treat it. We are going to be with you. I said, okay, fine, good. So these are the different stages. Maybe this is the healing stage. This is the first stage. Okay. Then comes this. Then comes this. Then with our medicines, slowly that skin getting, the epidermis is getting peeled off. The bullous was coming down. It took at least a month and a half for me to bring this down. I was also under a lot of pressure because this is my first case. I have sent pictures to most of the seniors whom I know. They said they don't know. They've never seen such a case. So what to do? So took a biggest risk of my life. I used to go to their house, see the cases every day, at least once in 2-3 days. And slowly, the results. Third day, fourth day, seventh day, eighth day, 10th day. See the beauty of the skin coming off, all the problems getting down. Different stages. The skin is healing. All the bullous is burst open. Skin healed. Okay, see the bullous. It is cellulitis. Okay, every step by step photos are there. One each minute it is coming up. And the last one. Skin has become this good, soft. Now this mark is not there in the second picture. This is after 1 week. This was 1 week before, and this is 1 week later. The right one is 1 week later. Now skin is very clear. And what is the benefit I got to us? They have referred me at least 100 patients. And their family will never go to any other doctor other than me. So that is the benefit we have got. So what was the patient name is Roma, age 59. Chief complaint is osteoarthritis. She came with that, 2 months vanished. Then she came with allergic reaction to Ayurvedic treatment. For our case, I have used a lot of medicines because every time I have to keep changing depending on the presentation. The medicines I have given us Echinacea dressing, Calendula and Echinacea dressing. That was the only and curcuma. These are 3 dressing which I gave it. It was offensive. So gunpowder was used. Gunpowder I used to give it every 2 hourly. That to 3x. Then I had to shift it to Restox 1M because the bullous and the cellulitis was getting worse. And the patient was not responding faster. It was going to worse things. The discharge was sticky. So graphitis had to be used. Petroleum, once the skin has become this stages, healing had started, only the peeling and dryness of the skin was there. That time the discharge was not there. I had to give, this is the stages where I had to give graphitis 30. Okay, this is the stage I had to give epismel 30. Why epismel 30? All you know, the epismel, the swelling and the bullous, and this one taught me. This is the stage I had to use the petroleum with calendula and echinacea dressing. See the sides, it started oozing and it was not sticky. It was watery discharge only, but it was not sticky. So every moment was risky because this patient was diabetic also. So anytime this can flare up and she had to lose, the amputation would have been needed. See that leg, see the water kept, she was drinking water, and see that towel, it was oozing one by one, it was oozing. It was one of the worst and toughest case I have ever seen. And what gave me what learning I got is, anything is possible with homeopathy. Only thing is that we should be ready to take the biggest risk. It is easy for us to refer the cases, say that it is not possible with homeopathy. This is something which gave me the immense confidence in taking any type of cases. And one thing, the learning which I have got is, never repeat graphitis 200. Graphitis 200, if it is to be given, it should be in one dose and wait. But the potency where it places, graphitis 30, you can repeat like anything. That is the learning I have got from this case. Calotropis. Calotropis is one of the best medicine, helped me in healing up this oozing. Calotropis, we know that calotropis is that what is that fluid or that milk which gives the rashes, almost exactly like this. So reading, taking risk, learning by mistakes. Staphylococcin has helped me controlling the secondary infection. Okay. So this is one case which I wanted to explain it to you. I wanted to show with the picture, because every time people come and tell you, SADATH tells all those medicines, but cases are not there. Now the cases are coming. I wanted to tell you. So medicines, I'm not going too much of it because everyone knows the medicine. I've used only common medicines which I know, I'm sure about it. So graphitis, petroleum, echinacea, internally also I've given it. Calotropis 30. Okay, gunpowder 3x, medicines used, all that has been explained. Another, this one is, another, the picture is going to be, these are the different steps of, stages of ulcer healing. Why this was also again important to important to us. Patient is almost 60, 70. Old age, less circulation is less. And this case was, patient name is Mary Philomena, age 70. Chief complaint is known healing varicose ulcer of 7-year duration. And that is after a skin graft. So we cannot even think about skin graft. Okay. So each stage, these are the stages of healing. Okay, this is the first stage. She came to me onto the left, okay, and into the right on the healing process. It took almost 20 days to just to get an this one, what are called skin to come up, or that epithelium to just show. These are the different stages. It is a healing. Only one small ulcer is there. This is almost a healed stage. Okay. Every different steps of healing up. Previously also we have got a lot of cases like this, but we never used to do a picture. We never used to take a picture because for us, I was just thinking that patients are our promoters. But nowadays patients are not only our promoters, pictures are also promoters. Because we need evidence based. Now everyone asks, where is your evidence? These are your evidence. This shows that Any case is possible, even the skin graft. And the medicines again I have used the same. Syphilinum vanam, Merxol vanam, Vipera vanam, Vipera 30, Calendula 30 internally also. Lot of medicines have been used because every time she comes up with what are called infection. One day these people never listen to the. We tell them not to wet the leg. They will have 101 excuses. And this when this case came, it was a rainy season also. June, July was this one. So every their house in front of the house, the water was clogged. So if she has to come to my clinic, she has to come only through the water. So we used to come and clear it. We used to heal. We used to wipe. We used to dry up. It used to take at least 30 to 40 minutes to even clean up the slough. We should have patience. Without patience, no patient is going to come. These cases, because anything can be treated easily, but these are the visible. Easily, if you treat a cancer, they are not going to tell others. These are the cases which we can show it to the people. Okay, this is healed. Okay, Staphylococcus, curcuma longa internally, curcuma longa dressing, Silesia tennum. Tennum I had given it because why Silesia tennum was selected, because my uncle, my father's brother, is a bedridden and he is under Dr. Ismail Said's care. And he had a bed sore, and that was treated with syphilinum, this one, Silesia tennum. And the bed sore was healing faster. So I just got this information when I visited them, and I had implied it here. And it has given me the very good results. You have to learn from every source. Be it your junior, be it your senior, we have to, this is for the juniors, you have to what are called exploit it, or you have to take it from the seniors, how to get this result, or what medicines to be given in different field, different time. This is another one case which gave me immense confidence in the sense you can't even think about it, what confidence we have got it. Because non-healing ulcer of 7 to 8 years, the half of that area knows that this lady has got this complaint, because this lady is very famous over there, their family is very famous, so half of that locality knew this cases, and she has been walking around with this ulcer for last 7 to 8 years. Someone told, okay, you go there and find out if it's possible and test. And these cases gave me a confidence of at least putting up a big hoarding in front of my clinic. It's called hoarding only, that varicose ulcers can be treated with homeopathy. And this journey began, and I can even give you how many cases of varicose ulcers. When I took varicose ulcers, because I've given it to you. This is the second case. Medicines explanation, stage by stage I can give you. This one, I started giving a calendula and echinacea internally. Calendula for 2-3 days. Once next visit, if the dressing is not healing, I changed to usually echinacea with gunpowder, 3x. It started healing, then I shifted to calendula. More the pus. Why echinacea was indicated as more the pus, more echinacea is indicated. When the pus started healing and when the granulation started coming in, calendula helped. Even the curcuma is also used in this stage when things were started healing. His calendula was not giving me, or echinacea was not, the dressing was not giving me the required fastness or quickness of healing it, because we were scared of the infection. Again, this patient was diabetic. So that was the biggest worry. So last one, this is healed. So every stage, homeopathic medicine is affected. Carbo is also given. See the healing process, almost healed on the right, left hand side, right one, last one. Merxol was given. See the edges, punched out edges. Syphilinum was given, punched out edges again. So Silesia was given when the pus was there. 10 one dose, and it helped me grow. So every pictures shows that we can give the medicines, and depending on the secretion, depending on the internal healthiness. So every stage, medicine keeps changing it. We cannot treat with a single medicine or one medicine every time. You got to keep changing the medicine. You have to be more observant. Okay. So this is the second case. This is another case. Almost like first case. This is complete diabetic. This came last 2-3 weeks. Okay. Patient is Susan Simon, age 54. Chief complaint is diabetic and cellulitis. Medicine used is acid first to control this diabetes. Fluoxetine. Fluoxetine is another one of the best medicine taken out from apple, that peel. Can reduce the diabetes faster than anything. You can give it in 6:30. Is this one. Again, Merxol, Silesia, Epismel. Hepasulf 30 also given because of the sensitiveness. Calendula and Myristica. So these are the medicine repeated. See, this is healing. See this first slide. Okay, first slide, it was completely oozing. That paper was wet in 10 minutes. Okay. See the healing process. The secretion has come down. The healing process is going on. They are supposed to send me the pictures today. I've told them, but I didn't get it. So, and this also is almost same replica of the first cases. Because of the first case only, I took this case. Because total cellulitis, patient was bedridden, what are called anemic. She wanted drip also. We arranged a drip at home. We went there. I used to go there, dress up, see the cases. She even couldn't even get up from the bed. So that was the condition of the patient where we could do something. It is biggest risk because we don't know when the cellulitis with the diabetes can go into the septicemia. So everyday monitoring of blood sugar, everyday monitoring of the wound, everyday monitoring of the heel. Now it's very easy. Video calls are there. We can see the cases. A lot of videos used to come, but I couldn't record it. They're not good at that. What I call. Now also technology is also not too in control of me, but still is this pictures they have sent to me. By God's grace, everything can be controlled. Okay. These are the three cases of skin. I wanted to show it because other cases, everyone has that lot of cases of psoriasis and eczema, everything. But this is a case with the total risk of life also, total risk of the age also, total risk with the even third one was life threatening. Even she was bedridden totally because of. Okay, so I'm just stopping this video. Now I'm going to share what is an alopecia case. Alopecia is another beautiful cases where we can master. I can show you 2-3 cases. Can you see?
No, not that
No,
started.
one second, sir. 1 second. Just give me a minute. Yes. Okay.
Yes.
Okay.
Yeah.
I'm not going to go to the theory part of it. Everyone knows what is alopecia, and 101 people are treating it. This is for the juniors. All that stuffs are there. I'm going with the case direct. Okay, picture wise. Okay, step by step. This is the first one. On to the left. See the next picture. This is also same time. Slides. See the growth. Okay. See the difference. Now it's grown too beautifully. See the case. This is the actual picture sent by the patient. Okay. Patient name is Arun Raj, age 37. Here the medicines used were testis 3x, thyroidinum 3x, selenium 3x, syphilinum 1m, thallium 30, acid floor. These are the different stages. Every month we used to keep changing. Every 15 days, 20 days, we used to keep the changes. Okay, Baraita carb, acid floor, thallium, everyone knows it. And I used to have my hair oil. And we used to have our shampoo for us directly with the hair oil is used. We have to clean up. Okay, alopecia theory, I'm not going to go about it. What all few things which we have to be taking care of it. One, why the alopecia, cause of it. Okay. If the alopecia is due to dandruff, kill that cause first. So the medicine will be used as my first and foremost medicine for any kind of dandruff is graphitis. No medicine, no treatment without graphitis for the dandruff. Okay. So cause of the alopecia is more important in treating. And miasm of the case. Alopecia, this is almost total, almost gone. I will show you another case. Alopecia, what we have to take care of is cause of the cases. If it is dandruff, the first and foremost medicine is graphitis. Then the Kalisulf, sepia, mesoria. These are the 4 medicines which cochlearia internally, cochlearia tincture internally. And the Badiaga. This 5-6 medicines, if it is there, you can clear up any of the dandruff. Plus constitution, yes, we'll have to go about the constitution wise also if it is required. But, but you have to take care of the whatever thickness, seborrheic dermatitis and just a dandruff. That is the difference. Seborrheic dermatitis, and even in the dandruff, you have to think about the psora as a background. Plus, you'll have to think about the destruction part of it. Why the dandruff is excessive exfoliation of the skin. So how quick the exfoliation takes place, it depends upon the miasm. If the more the destruction, going into the tubercular or syphilitic. So add up syphilitic miasmatic medicines, at least one dose, then start your treatment for any kind of seborrheic dermatitis, psoriasis, as well as we will see it's we will think that it is psychotic. Psychotic happens. Psychotic is rarely comes because if the more the thickness of the dandruff, or if they say that the thick, whatever, if it's a powder wise, it's sora. If it's a thick flakes, it is going to be syphilitic because more the damage, more the exfoliation, faster the exfoliation. That makes the thickness hard. So when that happens, syphilinum is the my choice. Okay, can differ, but my explanation of this one is syphilitic miasm. So miasm also plays a role in the treatment of dandruff and alopecia. Alopecia in that we most of the kids has it, most everyone in the rounds. Alopecia areata in patches. Syphilinum and acid fluor is the medicine. Without thinking these medicines, you cannot do anything with this one. Plus constitution. Constitution is a must here because it is what I call self-destruction. Not that we think that it is just an hair fall. It's a self-destruction, and the expression is hair fall. So that patches is syphilitic miasm, and acid fluor is another of the best medicine. Acid phos also comes. These are the few medicines required only for that. It heals off. And the medicine repetition should be, I used to give QDS or TDS. Maximum is QDS has to be repeated because this hair follicle grows in minute 0.5 millimeter, less than that. So we have to keep bombarding it. We have to keep giving the medicine in frequent repeating. Even in this kind of alopecia, you have to give medicines repeatedly. One dose waiting is not going to help you because the slowness and the hair growth and these patients will make you terrible. Even if they have the cancer, they don't bother. If they have a hair fall or baldness, you're finished. So these all are cosmetic stuff. So cosmetic stuff has more value than anything else, and it gives you more publicity. Okay. I think I have 10 more minutes. Okay. See this. This is hardly 1.5 months. See the growth in 1.5 months. See the difference. See the growth on the vertex. See the hair growth. This is a step by step. See the difference. See the vertex. The hair is covered. This is all in 2 months. See the hair coming up in front. What I say is homeopathy can bring hair even if in Thar desert. Up to 50 years, a man comes with us to us with alopecia of this sort, complete baldness, we will be able to do it. See, these are all the different stages of this alopecia. Okay. So go back to the first one. This is all coming. This is almost a month case. Hair is growing. See the difference. This is hardly 2 months or 2.5 months. It is totally, it will come up. It was totally like Thar desert of, and homeopathy can bring up such a difference in his head. Patient name is Unais. I can give you any number of cases, but the time is hardly another 5-6 minutes. Medicines used is thallium. Selenium is one of the best medicine for hair fall. Cipelinum vannam, lycopodium, acid fluor, wonderful medicine. Baraita we used to give only for the doorfish and quinsy, everything. Baraita carb is one of the best medicine even for hair fall. Okay, and the medicines I uses and the hair, I just wanted to explain the hair oil. Okay, hair oil is something which we have to make it for ourselves. I have used only, then I have used that Gandagapala. Gandagapala in case of this one, dandruff cases. Okay, that will go. Dr. Said's homeopathy is almost 20-25 homeopathic tinctures. We have used only homeopathic tinctures with castor oil, 20%, 100 ml if you take it. Medicines totally 10 ml, 20 ml of castor oil, then 70 ml of coconut oil. Coconut oil has to be purchased from a reputed, or we should be knowing, because adulterated or sulfur content added coconut oils are there. Parachute, something of that sort should not be used. I'm not talking about the brand. The sulfur added coconut oil should never be used in the case of alopecia, because it can create sulfur clogging will come, and the hair follicles will get damaged because of the sulfur clogging. In crude form, sulfur will be there in all the coconut oils. So we have to see to that the coconut is given to the mill and get the coconut oil directly from the mill. Okay, so we have to take little pain to get the result. Everything is easily available. That doesn't mean that we can be doing anything. We have to do little research. We have to do a lot of, and castor oil. Why I have used this? Whenever in our childhood, we used to, in the teenagers, we used to say that I'm not getting my beard or I'm not getting mustache. What we used to do, tell them is use castor oil. So that knowledge or that was stuck in my head. So we used to experimented it here, and it worked wonder. And beard also, beard cases beautifully we can treat. Same principle, same thing. We can apply to the this one. Shampoo also. Shampoo we get it specifically for us. We have a chemist. We get it in a small quantity also, not a big quantity, 2 liters, 3 liters. We used to keep stock of it. We tell them add calendula into it. We tell them add aloe vera into it. And aloe vera, I have not got any result. Basically, I'll tell you, aloe vera, I have not got result in this case. Okay. So with these two cases, alopecia cases, I am just telling you that another things which we used every time we used to get it is graying of hair. Honestly, I'm telling you, I have not got any result. I'm a big zero. I have not done anything. I couldn't do anything with the graying of hair. I don't know about others have done it. Graying of hair, a lot of people have done it, but honestly, I say goodbye to them. If still they insist only, I take them. Okay, we'll try. Other than that, graying of hair is my big zero. Plus, another one beautiful thing is what we get at as lice, head lice. Almost specific medicine is pediculus. You give pediculus, you can give Cephysagria, you can give Basilinum, you can give any other medicines. Cochlear is also good. You can give any medicine, but my first choice is pediculus. Okay, so these are the few medicines. And one more thing I want to say is alumina, not alumen. Alumina is one of the best medicine for hair fall. And we have to say 2-3 things. Ask them to use multivitamin if possible, or you give multivitamin or 5-fours. We have a 5-fours, no, calcarea fours and all that. If you can supplement it. It is very good. 5-fours is another good supplement. You can give it if at all required. Biochem. Multivitamin helps it. Zinc is another one of the best medicines. Selenium is best medicine. Alumina is another one medicine. What I have to suggest is either you prepare food in the copper or mud. Alumina gives lot of problem for the hair. So restrict that. If at all you have a history of their cooking it in aluminum, this one you can give alumina. Alumina is another one of the best medicines. Try that. So few things we'll have to take care of it. Again, syphilinum, thyroidinum, syphilinum, again the medicine. Again, constitution medicine, if you can get it, well and good. But miasmatic medicine, syphilinum is one of the best medicine. A hair fall of the dandruff, you have to see that. This one, sorinum, again syphilinum, or any other miasmatic. And if you take care of that, carcinosin, hereditary is also has to be thought about. Carcinosin can also play a good role. If there is a history of carcinosin and a hereditary of hair fall, go for carcinosin. So these are the few things. You don't have to be a big doctor. You don't have to be any junior, anyone who's just thinking about cosmetic and hair fall. Anyone can do it. One is COVID hair fall. What else you want? Thallium is the best medicine.
Good.
Nothing beats thallium. And see what you every time I used to get this one is I used thallium. I use this medicine. We all use almost see hardly 20% of the medicine I differ. Okay, I differ from others is just hardly 20% because I've got that kind of a training even from my seniors. So we used to keep thinking about it. 20%. Rest everything is what everyone is using.
There is a part 2 in the question. Hormone imbalance hair fall. What medicines?
So that is PCOD. That is what you are thinking about it.
Maybe.
PCOD has to be corrected. That is the only thing. Then you can almost same medicines of hair fall, but without correcting PCOD, hair fall is not going to stop it. The basic cause, pre-menopause also lackses and estrogen. Estrogen is another best medicine for pre-menopause. Estrogen is the progesterone 30 is the estrogen, the totopathy we can use more frequently here. Estrogen higher potencies can help you in even in the cases of this one, lackses, the best medicine. Lycopodium is check out for the ovary, shrink.
Yes.
So that helps in the menopausal ages.